Hi guys, welcome back to my channel. For those of you that are new here, my name is Romi. I am currently a first-year medical student and I am a registered nurse with over 4 years of experience in OB, gynecology, and labor and delivery. If you're new here, don't forget to hit that red subscribe button and follow along to watch my journey. And if you are a returning subscriber, hello, welcome back to the family. So nice to have you here. I'm so excited to be sitting down with you guys and just doing another sit-down video. Please don't mind my messy background. We are going to go to San Antonio here in a little bit and make a 3-hour drive down to San Antonio to hang out with my parents for the weekend, to take a little medical school break and just not think about medical school for the weekend. So I'm so excited to do that. So we're currently packing and doing laundry and everything, so just don't mind all of that. Today's video is going to be all about nursing school or medical school. Which one should you choose? Which one is better for you? I get this question a lot in my DMs. Lots of you guys are interested in healthcare, but you're not exactly sure whether you should pick nursing school and become a nurse or go to medical school and become a doctor. Today, I'm going to be talking about questions you should be thinking about as you're trying to make your decision and kind of the differences between nursing school and medical school and like the years and things you need to get into nursing and medical school, as well as if I had to go back, would I choose nursing school and then go to medical school right after again. So I'm going to be answering all these questions in this video, so if you're interested, stay tuned. So a lot of you guys have been asking me my DMs on Instagram. If you don't follow me, go ahead and follow me. It's at Romi Joy. And you guys are asking me the pros and cons of nursing school or medical school, kind of asking me the differences between them. You guys aren't sure which route to pick. And I kind of just like to give my general advice and kind of how I picked nursing to medical school instead of one or the other. And I feel like I like to give a lot of advice, so I think it'll just be easier just to make a video that I can send you guys whenever you guys ask me this question, because I like to give lots of detailed advice and everything. And just know, if you guys ever have any questions, you can always leave me a comment down in the video below and I try to answer every one of your questions, or you can just DM me on Instagram and I try to answer every one of your questions on there as well. I have my notes right here on my phone that I was kind of making a little bit ago, so I don't lose track of what I want to talk about. I kind of just want to give a little bit of a background of nursing school and medical school, kind of the years and all that stuff. Nursing school is generally about 4 years after high school, so it's about 1.5 years of prerequisites to get into nursing school, and then 2.5 years of nursing school, and that is for a bachelor's, a BSN degree. It's about a year less if you want to get your associates in nursing or your ADN. So there's differences in that. I have a video about it. I'll link it somewhere up there for you guys to check out, of different ways to get into nursing school after high school. Like there's different community college routes and accelerated nursing routes that I talk about, so make sure you check out that video if you haven't already. After you get your degree, you literally apply to any kind of specialty you want to, and you become that type of nurse. And you can always change out, switch out specialties if you're interested in something else, like if you're interested in pediatrics and then you want to do OB next, or you want to do surgery or outpatient. There's so many options in nursing, and that's the beauty of nursing. But that's kind of a little bit of a background of the schooling of nursing. So medical school is 4 years after you get your bachelor's degree after high school. So you go to high school, you graduate high school, you do a bachelor's degree, which is generally about 4 years in any type of degree you want to do: business, psychology, engineering, mathematics. As long as you have your medical school prerequisites, I will put down in the description below. If you get your prerequisites along with that degree, you can apply to medical school. After you get that 4-year degree, then it's 4 years of school after that undergraduate 4-year degree. After you go to medical school, you have to go to residency, and residency is where you train from 3 to 7 years into a specialty of your choice, whether that is surgery, OB-GYN, pediatrics, family medicine, internal medicine. There are different specialties you will train in from 3 to 7 years depending on the residency, and after that you become an attending. You're not in training anymore and you are a doctor, and you get to work at pretty much any place of your choice, and you just apply to a bunch of places afterwards. So in total, nursing school is about 4 years if you're going for a bachelor's degree, a straight bachelor's degree after high school. then you become a nurse. Becoming a doctor and finishing residency and everything takes about 11 to 15 years after high school, depending on the residency and everything that you pick. A little bit of the background of nursing school versus medical school and the amount of years it takes to do both. Let's move on to which one is better for me and which one should I pick. So to answer this, I like to tell people you have to figure out what you're passionate about and where your priorities lie. So you have to kind of ask yourself questions like why you want to become a nurse or doctor. And you might answer, well, I'm not sure. Like, I really like taking care of people. I know I want to work in healthcare. I'm not sure if I want to do the nurse route or the doctor route. Or you know you want to take care of people but you're not sure in what way. I'm just going to quickly describe kind of what nurses and doctors do and kind of the differences to help you in that choice. So if you want to be involved in diagnosis and treatment, opening your own practice, learning the medical model and pathophysiology of why certain diseases happen or the mechanism of how some medications work in the body, you have to also ask yourself if you want to take care of a specific patient population, as in perform surgery, do mission work and do surgeries in third world countries, or if you want to deliver babies. Those are just little examples that you can think of if you are thinking about a specific patient population and thinking about the things that physicians can do versus nurses in that aspect. You're also going to be the person who decides what this patient has. How am I going to go about treating this patient? What orders am I placing to treat them? You have to be able to critically think and do all this total care in diagnosing the patient, and that's all up to you. If these things fascinate you and you're really interested in things like that, maybe medical school is something you should consider. On the other hand, are you interested in maybe the nursing model of taking care of patients, which includes more direct care of patients at the bedside, learning about disease and symptoms and treatment methods, administering medications and performing detailed assessments, skills like starting IVs and catheters? If those things kind of excite you, then maybe you should consider nursing. Like I was saying earlier, the beauty of nursing is that you can switch specialties at any time you want to, pretty much throughout your career all the way until you retire. You don't have to be an OB nurse the rest of your life. You can always train different specialties, leave. That's the beauty of nursing, and that's why I was very attracted to nursing. Whereas medical school, if you decide to become a doctor, you kind of have to stick to that specialty unless you do a fellowship. Now, a fellowship is another like 1 to 4 years, depending on what that specialty is, of school on top of that residency. So if you do 4 years of medical school, 4 years of residency, and then you decide you want to do surgery or something like that on top of your specialty you pick, that's another like 3 to 4 years of learning and training to finally become what you want to be in the end. So it's a lot of school, and you can't just pick certain specialties and switch whenever you want throughout your life as a doctor. You could do that, but you have to get into different residencies. It just gets very, very difficult. If you know what you want to do and you are sure you want to stick to that, then this is not that big of a deal. In the hospital, most nurses work about 3 days a week as a full-time position. In the clinic, there are lots of clinic jobs. There's lots of things for you to choose from as a nurse. You can work 8 to 5 days a week. You can work telephone triage. You can work home health. You can work literally in many different areas as a nurse, and you have so many opportunities. You can go just give vaccines in a clinic. You can monitor somebody's COVID symptoms over the phone. Like, there are so many cool things that you can do as a nurse that have so many opportunities. As a physician, you can also do telehealth. You can work in clinics, you can work in hospitals, you can work on call. There are lots of different options you can do as a physician as well. Nursing, the options are limitless. Like, you can go up into case management. Of course, you can become a nurse practitioner or midwife. There are lots of different options that you can do that require extra schooling, and you can do similar things as a provider. So I'm not going to get into that right now. I'm just talking about nursing school versus medical school in this video. Becoming a nurse practitioner is a whole new story. Also, in nursing, there is more family time, and you can start a family sooner compared to medical school. It's a lot harder in between those 7 to 11 years to decide when you want to have a family. If you're a man or woman in medicine, there's a lot of thought into it if you're interested in having a family in medicine, and you have to do a lot of thinking and figure out kind of like a good timeline in between school and everything, because you don't get many breaks in between those 7 to 11 years. You're kind of just year after year after year after year in school. You kind of have to think about that as well in your decision in becoming a nurse or doctor. To ask yourself all these types of questions to determine what exactly you want to do. So once you determine what you're going to do, you're going to have to work extremely hard to work towards that goal. I want to start with medical school first. Medical school is extremely competitive to get into, and it is just getting more and more competitive every single year. Medical schools look at things like your undergrad GPA, so your bachelor's, what you did in college, your GPA there. They look at your MCAT score, which is the entrance exam to medical school. They look at things like research, volunteer activities, extracurricular activities you did throughout undergrad, work experience, shadowing other doctors. They look into all these things to make you the perfect medical school applicant, and that's why it's getting harder and harder to get in, because people have to look better and better on their application. Getting into medical school is a really hard aspect, but you have to work extremely hard in medical school as well. While you're in medical school, you're supposed to be doing research as well. They're going to look at extracurricular projects in your residency. They're going to look at if you shadowed other doctors. They're going to look at volunteer work and your grades. So they're going to look at your board scores, your step scores. So it doesn't just stop there as a medical school applicant. It goes throughout medical school as well, so you find the perfect residency position to get into and make yourself a competitive applicant in that way as well. There's a lot to think about if you're ready to commit to medical school. You really have to think hard about and make sure you are ready for this commitment. And that's why I tell a lot of people, if you're not sure you can commit to all the studying in medical school or the studying it takes to get into medical school, then either change your mindset and work towards those goals to make yourself a more competitive applicant, a harder studier, and get your grades up. You can always do it as long as you change your mindset. If you're thinking like that now, you can always change it and become a better applicant for medical school. In nursing school, they look at things like your high school grades. They look at your prerequisite grades that you do for that year and a half in college. They look at your T-score, which is the entrance exam into nursing school. They used to call it the HESI, but now it's called the T's, I believe. They also look at volunteer experience and extracurricular things you did kind of in high school and the first couple years of college. They look at all those things to make yourself a competitive applicant as well. In general, medical school is harder to get into than nursing school, but nursing school is getting more and more competitive as well. I know when I applied to nursing school, it was really easy to get in back then. Now I know they're doing things like personal statements and doing all these things that are similar to medical school. Like the interview process is a lot more difficult, whereas like I didn't even have an interview to get into nursing school. They just looked at my grades and they looked at all the things I just talked about, and then they considered me as an applicant, and then I got in that way. But I know now they're interviewing hardcore. I know it's getting way more competitive these days, so keep that in mind if you are looking to apply to nursing school as well. So another thing that you guys ask me is, what if I'm not sure and I want to do both like you did? Do you regret doing nursing school before medical school? And if you could go back, would you do it again? And the answer I always tell you guys is yes. I would do exactly the route I did, which is go to nursing school and then do medical school after. I worked as a nurse for 4 years in between nursing school and medical school while I was trying to apply to get into medical school, just because it was extremely competitive for me to get in and my scores were on the lower side. Doing this is totally possible and completely feasible for someone to do, because lots of people come into medical school with non-traditional majors. Traditional majors are usually things like biology, chemistry, biochem, things like that. Things that have the prerequisites included in their 4-year curriculum. So you have all the prereqs required to get into medical school with that undergrad degree. Whereas nursing school, you don't have any of those prerequisites, except maybe like one thing I had, which was stats and English and things like that. My science classes did not coordinate with my nursing school classes. The only thing with nursing is that it is one of the most stressful and time-consuming degrees, undergrad degrees that you can do. There is hours and upon hours of clinicals where you have to be there for 12 hours shadowing nurses, doing simulations in the lab, and on top of that you are going to class and studying. On top of that is so much work in nursing school, so it can be extremely difficult choosing nursing and taking your pre-med prerequisites at the same time, which is what I did. I finished my pre-med prereqs and nursing school in all 4 years. If you want to, I know of people who have finished their nursing degree and then took 1 to 2 years after nursing school to get their pre-med prereqs after while working as a nurse, which can also be difficult because you're working full-time and you're taking classes that may require you to come in person. That's difficult whether you work days or nights as a nurse. So lots of things to consider if you want to go this route, but I absolutely loved it. I was very thankful that I chose this route because I was able to build up my clinical hours as a nurse. I got like over 7,000 hours as a nurse in clinical experience before I applied to medical school for my last time. I have tons and tons of patient experiences which have helped me in my clinic currently in medical school, and I just think it made me a great well-rounded applicant and has been helping me in some classes in medical school. So I absolutely would not go back. I was thankful that I did it and grateful that I pushed through because I knew where my priorities lied, and that was to ultimately get into medical school. And I was just thankful that I stuck through and pushed through. I had to change my mindset multiple times. I kept thinking to myself that I wasn't good enough, I wasn't smart enough, I wasn't able to get in. Changing my mindset definitely helped me get in and update a few things on my resume and just boost my resume and strengthen it and work on it throughout the summers to make myself a more well-rounded applicant. So I would not go back, and I do not regret my decision. I'm so thankful to be a nurse. I'm thankful to also be able to work while I'm in medical school. So overall, very grateful. I hope this video answered all of your questions, and I hope I was able to touch on a few topics to help you in your decision, whether you want to pick medical school or nursing school. Whatever you pick, work hard. You can do anything you set your mind to. Even if you have a C in class. I had a C in one of my classes in undergrad. So you can always do it. You can always get into whatever you decide to do. You just gotta work hard and keep at it. And if you have any questions at all, please leave me a comment down below, or you can DM me on Instagram. I love responding to you guys, and I love talking and interacting with you guys. If you haven't already, please hit that red subscribe button to join the family and follow me along my journey and support my channel. It would mean so much to me. And that is all. I will see you guys in the next video. Bye!